Caring Unveiled with Jarrett Stahl.
Welcome to Caring Unveiled, a quarterly program brought to you by Memorial Health Foundation. This series is our way of connecting with you, our generous supporters, and offering a behind-the-scenes look at the compassionate care being delivered across our region. In each episode, we'll introduce you to the dedicated team members who serve our communities, highlight the life-changing services available close to home, and shine a light on the mission-driven work happening every day at Memorial Health System. We're thrilled to have you with us for this episode. Today's guest is Rusty Fleeman, Laundry Supervisor for Memorial Health System. Rusty, thank you for joining us today. Let's get started. Tell us a little bit about yourself and your time with Memorial Health System.
I've been with the Memorial Health System for a little over 25 years. The first 18 years were spent in the maintenance department, and then I moved over to be the laundry supervisor, and I'm there currently.
Well, you've seen a lot of changes happening over that time with our health system.
A lot of additions and a lot of building has taken place.
Absolutely. Well, before we dive into everything about laundry, I know this is something that maybe a lot of people don't always think about when they're thinking about hospitals and healthcare systems, but tell us why this is such an important part of patient care.
The biggest thing is it's not a glamorous job as most would think about, but it also provides a service to the hospital where it's a money savings as far as using renewable resources versus buying new resources as far as disposable linens. It also is useful for the prevention of spread of infection and disease. So that's where we really shine.
Well, I had a family member that recently had a procedure done in our health system, and when we were there, I was counting the linens on the bed and the blankets that were around, and they asked me, "Why are you doing that?" I said, "We're preparing for this segment," and I hadn't thought about that. But there's a lot of linens that go into just one patient for one simple procedure. What is a typical day like for your team?
You mentioned the volume, and if you take into consideration, we serve the main campus, the Belpre campus, Selby, and the outlying buildings and physicians' offices, and that could amount to up to 6,000 pounds a day.
Per day?
Per day.
Wow.
Yeah.
Wow.
Yeah.
And so what does that translate to a year?
Roughly, we haven't broke the 2 million pound mark yet, but we've been flirting with it every year. So we're 1,000,009 and some change.
Oh my goodness.
Yep.
So almost 2 million pounds of laundry per year.
Yes.
So how many people does that take to service our entire health system?
Done with 20 employees, and only one of those is part-time. The rest are full-time employees, but yes.
Wow, that is amazing.
Yeah.
And so you're servicing all of our campuses and so forth. So you're having to work logistically with trucking things around as well, right?
We coordinate that through materials management, and they truck the linens for us. And we do have a computerized system where they can do linen requests and that kind of thing. And there are standing orders that we fill for the customers also.
Sure, absolutely. So what are some of the, just getting into some of the details, some of the sanitation protocols and things that maybe we wouldn't think about when we're doing laundry at our own home?
In order to prevent healthcare-associated infections, we're constantly cleaning high-touch areas. And as you take carts, bring them back with soiled linen, they're cleaned before they head out into the facility again. And you wouldn't think, but like the washers, once you select a formula, you have to clean that surface again, or the door handles before you come back to remove the linen that's been processed.
So there really is a lot of process that goes into this that has to be followed in your staff training. It's not as simple as we think of putting laundry and taking it out, folding it, and putting it away.
Yeah, a lot of policies and procedures that have to be applied.
Mm-hmm. Well, we talked some about your team. I know you're very proud of them, and the team that's here and that live here in our community and the communities we serve. You want to talk a little bit more about them?
Well, to me, I take pride in the fact that these are local jobs that we've kept here locally, and they've 8 years ago, roughly, when I started over there, the turnover rate was a little bit high. And in the recent fiscal year, beginning October through June 1st, our turnover rate was 0% for an entry-level position. And I take great pride in that. And part of that is creating the environment where people are free to express themselves and have have a good time in a job, like I said, is not particularly glamorous.
Mhm. Well, we know you do a great job keeping them engaged, but they clearly understand the important role that they play. And you mentioned maybe a job that's not glamorous, but it's also a very hot
Yes.
job, right? And the environment. You want to talk a little bit about that environment?
Right now, we're filming this in July, and in our department right now, in the afternoon, it can be about 90 degrees. Fortunately, we do have what we call task cooling, where air conditioning can, in strategic places, be falling down over the employees, but in the general areas, it can be in 90 degrees in the afternoon. So,
Oh my goodness!
Yeah.
Wow, they are dedicated
Yes.
to this, and yeah.
Yeah.
And you and I have talked before. There's other factors outside of just of what's happening in the hospital that impact laundry. So when there's water pressure issues from the city coming into the building, those kind of things impact what you're all able to do and how you're able to service our patients.
yes, we have to adjust as far as, like, the city has experienced outages here lately, and once the pressure drops below 20 pounds of pressure, our washers won't function correctly. So we're forced to, take a break from washing and focus on other things and then play catch up. And that's the other thing that a lot of people don't understand is ours is linen is done in real time. And basically there's about a 4-hour turnaround from the time it hits our door to the time it's on a shelf or it's on a cart ready to go back out the door.
Oh wow! So you're turning around everything. So it's
Yes.
So we I don't think we mentioned that the hours in the operation of
It's
time.
on a Sunday night through Friday, we work 24 hours a day, and we're there on the weekends, 7 a.m. to 3:30 p.m. on a Saturday and Sunday to serve the campuses.
Yeah, it's all the time.
Yes.
It's all the time. Wow. Well, is there anything else that you would want to share with our donors and supporters that they may be interested in knowing about the laundry service?
Probably the biggest thing is the way we've invested in the newest technology for an on-premise laundry. I mean, obviously, we don't have tunnel washers because we don't have the room to house that big of a machine. But we have invested in the newest technology as far as washers as we replace to keep things going, and the wash chemistry. We're doing everything there to keep everyone safe with that.
Well, we appreciate everything you and your team's doing to keep us safe, to keep us operating. I know we've previously had physicians on this program before that has talked about the importance of laundry as well as housekeeping, environmental services to all of our operations and to the surgeries and procedures they perform. So it's a big part of what we do, an important part. And so we thank you and your team for that. And we appreciate you coming on the program today to share more about what you all are doing.
Thank you.
And to our viewers, thank you for spending time with us and for your continued support of Memorial Health Foundation. Your generosity fuels progress, expands access to care, and strengthens our entire health system all the way from Marietta to Sistersville to Athens and beyond. Keep an eye on your inbox for the next edition of Caring Unveiled, where we'll continue to share inspiring stories and meaningful updates. If there's something you would like us to feature in a future program, I'd love to hear from you. Don't hesitate to reach out. Until next time, thank you for being a vital part of our mission. Take care, and we look forward to connecting again soon.